Chris Little.
Question number 1.
Thank you very much, Mr Deputy Speaker. As the members are aware, mental health is one of my top priorities, and this includes delivering better child and adolescent mental health services, or CAMHS, for people under 18. To do this, I will pursue a particular focus on prevention and early intervention. This will be done on a cross-sectoral basis, particularly with colleagues in the education sector, to promote emotional, mental well-being in schools, educating our young people on their mental health, and strengthening the links between schools and mental health support services. In parallel with this, I also want to deliver investment to tackle long and unacceptable waiting lists, so that our young people do not have to wait longer than 9 weeks to see a CAMHS professional. This, of course, will require the support of the Executive in the forthcoming budget process, and this additional investment will be used to address current workforce challenges in the sector and improve access to CAMHS, to ensure our young people get the help they need in terms of providing CAMHS, a particular focus on work will be leading the interdepartmental work on the action plan in response to the Children's Commissioner's Still Waiting report. Finally, in line with the new Decade New Approach Agreement, I will publish a mental health action plan by the end of March and a mental health strategy by December 2020. This will be informed by the findings of the Regional Children's Mental Health Prevalence Study, due to report later this year, and will set out the strategic direction and service requirements for CAMHS over the next decade. In all of this work, I am fully committed to working in partnership with all relevant stakeholders to allow everyone to have their say in shaping what our mental health services will look like in the future.
I call Chris Little for supplementary.
Thank you, Deputy Speaker. Thank the Minister for his answer. The Minister will, of course, be aware of the level of anger across our community at the inadequate investment in mental health services for children and young people, and indeed a system that has been found by the Children's Commissioner to be under significant pressure, finding it difficult to respond to the scale of need and the complexity of issues with which children and young people are presenting. So can I ask the Minister what specific urgent actions he is taking to urgently improve the provision and investment of mental health resilience and suicide prevention services available to young people in Northern Ireland, and will he meet with the Northern Ireland Youth Forum on this matter? Thank you.
First of all, certainly in regards to meeting the Northern Ireland Youth Forum, I think they already have a question in. But in regards to the specific actions, I'm fully aware of the NICI report of the Commissioner for Young People and what actions and recommendations she's brought forward. We haven't been able to fully scope all 50 of those recommendations into what our future mental health strategy will look like. But as I've said in my opening comments, funding for our CAMHS service is one of the major stumbling blocks that we have at this minute in time. The investment in CAMHS is now over 20 million annually. That's actually double what it was 10 years ago. But this figure does not include investments made by the Public Health Agency in a wide range of children's services, such as family support services, safeguarding and primary care service. So in addition, over £500,000 of non-recurrent investment from transformation money was made available to CAMHS specific projects in Northern Ireland in 1920. It is well recognised CAMHS is underfunded, but I hope to address that in my tenure as Health Minister with support of executive colleagues.
I call Pam Cameron.